Mike, welcome, sir.
Cliff, thank you. You do a fantastic job every year. So I get to make the closing remarks. Let me start by saying, I think one lesson here is you never want to end with Eeyore. And you want to see me. That's the other message. There. So never end with Eeyore. Thank you to Cliff. I'm going to largely talk about where to go from here. And first, I want to make the following points. There's several points from this slide. The first one is no matter what year you want to talk about, you can almost always find a year when Tom Brady won something. So when we were thinking about VBID in 1999, you got the picture of Tom Brady on the left. When we published the article on benefit-based copays in 2001. You have the Tom Brady in 2001. The most recent data we could get was in 2018. There's Tom Brady winning the Super Bowl. And in fact, if you want to go then and now, and you really want to get to now, there's Tom Brady. Now he is a Buccaneer. In any case, the main points of this slide is not about Tom Brady, but, and you should all know I'm a Steelers fan. When we started this in 2001, we thought it was really important. Healthcare was 14% of GDP. Now it's pushing, in 2018, it's pushing 18. It's higher than that now. The average family premium, even after adjusting for inflation, is roughly doubled. Average family premiums, the share of median income, also almost double. You heard about this sort of affordability issue. These are just some numbers. The out-of-pocket share has risen. For folks. The percentage of people with high deductibles have gone up almost sevenfold, and the amount of those deductibles in a single plan has also gone up a dramatic amount. So however important we thought we were in 2001, this is just a much, much bigger issue now. And so you either might think we haven't really been very successful, or you might think it's more important than ever. I realize I'm the Eeyore. I'm going to go with more important forever. Imagine how bad the world would be without any VBID. And in fact, Amitabh kicked off the whole day pointing that out. So to get to the theme of what I want to talk about, where to go from here, I'll be very brief because Mark's going to text me when I need to shut up. The first one is emphasize low value care. The way I would think about VBID would be, we got into it for the health, we stayed because of the money. And you're just not going to be able to move anything forward until we can find a way to make VBID and access to high value care at least fiscally neutral. And that's going to need some attention to low value care. And again, if you followed what Mark and I have been doing lately, there's a big emphasis on low value care, with a lot of support from a lot of people, many of you. Implementation, there's a huge discussion. I think every panel discussed on aspects of implementation. I'll say a few things. One of them is a lot of emphasis on definition of high and low value and measurement. I'd be remiss if I didn't say particularly of low value care. Mark and I have been working with some folks at Milliman on the health waste calculator to help do measurement, but measurement's going to end up being important. Maybe that just shows I'm an academic. I think it's really important, and you saw on the agenda today, the different stakeholders, that we find the right balance for different stakeholders. What role should each one have? So that's the patients, the providers, the plans, and then the employers. I'm kind of where Jill Berger was, that we really need to push the employers more, but everyone in this equation ends up being particularly important in terms of figuring out what to do and moving us forward. And we have to work on getting the different stakeholders to move us forward in general. That's going to require some more work. And I think Patrick Conway said this early on, we do need to take something that is inherently complicated and nuanced and keep it simple. And I think there's a lot of work on how to do that. I am the vice chair of the Massachusetts Connector, for example, and we have a program in our standard benefit designs, that's the key word there, standard, that simplifies access to services for patients with diabetes, particularly insulin and some related things. So number one, low value care. Number two, implementation. I'll go through a few other very quickly. One, you've heard Mark talk all the time about peanut butter and jelly. What that basically means is we need to integrate benefit design with payment. I think we are getting there, but we're really at the beginning of that mountain of the integration of payment reform and benefit design. And so there's a lot of work to do in that space. There's a lot of discussion today of my next point, which is digital health. I will just say in response to some of the things I think Marge, but a ton of people said this is telehealth, or more broadly digital health, turns out to be both high value and low value. After the pandemic, it will be both high value and low value. I've been in a lot of meetings lately. People have sent me messages in the chat about how telehealth saved their lives. They were having almost a burst appendix, and telehealth saved them, which is wonderful. But as it is also possible for a lot of not so high value telehealth, figuring out how benefit design works, and payment for that matter, in a telehealth digital world is unbelievably important. Five, there's going to be a theme, I suspect, ongoing. You should know we've actually focused on this and published in this area for decades on health equity. In fact, I would say one of our big motivations going in was the recognition that healthcare out-of-pocket requirements were rising, which we were skeptical about for a bunch of reasons. But boy, if you're going to charge lower income people more, make sure they have access to their needed services. And I think we're going to be moving into a time where the equity aspects of VBID will be increasingly important, and there's a lot more work to be done in that space. The last one is, I understand we've had the Affordable Care Act, but there's still, I think, going to be a growing emphasis on insurance expansions. I've talked to some folks on the Hill about aspects of insurance expansions. And one nuance in insurance expansions is expansion of what? And I've argued the key thing is to make sure we have expansion to access of high value services. Giving a lot of people coverage, but not very good coverage, doesn't help you as much as making sure that people have access to the high value services that originally motivated VBID. So I think in an era where there's a discussion of expansion of access, particularly in the context of health disparities, but I would argue more broadly access, I think there's going to be a growing role for VBID in understanding how it can help balance the fiscal concerns with the need for better health. So I don't want to really ruin my brand by saying something in the end it's not very Eeyore-ish, but maybe I will. What gives me optimism about all of this, and it was clear today, is VBID is one space where people that generally disagree actually agree. I think Katie Spangler made this point when she was speaking earlier, and I think that sort of ability to fit in this sort of bipartisan, I'm not sure bicameral works in the outside of the legislative setting, but in any setting, you can get patients and providers to agree. You can get payers to agree. It's hard to argue that there should be barriers for services that everybody thinks is high value. And so I do think there's a lot of organizations of goodwill and a lot of stakeholders of goodwill that will help us work on some of the issues that I just raised. So with that, I'm ready for the next slide. The next slide is broadly a thank you slide. I will start with thanking the speakers on the panel. There's many things that are amazing about Mark, but one of them is his ability to recruit absolutely A-list speakers to everything. That includes Cliff, by the way, who's A-list moderator, but the speakers in the panel are absolutely outstanding, both in the job they did here today, but also in what they do in their day jobs. I could not be more grateful to the speakers. I want to be particularly thankful of the audience. We are always astounded at how many people spend time with us. At least until I was talking, there were still literally hundreds of people listening. Now it might just be tens of people, but at least it used to be hundreds of people. And so if you are still listening, we really, really do appreciate the time and engagement we get from folks that attend events like this. It really is not just the number, but the quality of people matter. And of course, the sponsors make it all possible. I express my appreciation, but really from the depths of the hearts of Mark in the VBID Center, a true thanks for all the things that you've done. I hope today convinced you that there has really been a big impact on people's lives for the investment you've made. And I really do, I speak also on behalf of Mark and the entire VBID Center, really do appreciate your support. So again, thank you very much. I want to thank The staff at the VBID Center, they have always made my slides look much better. They keep market in line, which is no small task, and they make these things run as smoothly as they do. So the Susan Lynn, Jordan, the rest of the VBID Center team, you really do an absolutely amazing job. So thank you. And as we say every spring, although not every spring in this context, every spring we say next year in the big house. So hopefully these Zoom or GoToMeeting sessions are wonderful, but there really is no substitute for getting to see people in person, maybe get to go in the field and kick a field goal, and learn a lot of things that through interactions that are harder to have on Zoom. So again, thank you all for coming. We really do appreciate your time, and we really hope for your continued support and to see you again in person in Ann Arbor when this very odd year is just a thing of the past. So thanks, Cliff or Mark. I'm turning it back to you to say final goodbyes.
Mark can have it. I'm sending it off to Mark.
Mark wasn't ready to get it hand off. Can you hear me okay, Cliff?
I can. I didn't think that was going to happen either, but Mike sort of decided that.
No, thank you, Eeyore. So I guess we'll just have Tigger say goodbye and thank you. And again, my appreciation to Susan, Lynn, and Jordan and the rest of the team. Here's how you can connect with us. We'll have lots of resources that we put in the chat, put on the website soon. And we look forward to following up with many of you. Thank you again. Have a good rest of your day.
Bye. Thanks, everybody.